food poisoning? Well, it is also called food-borne illness. It is an illness caused by eating contaminated food. Infectious organisms, including bacteria, viruses, and parasites, or their toxins, are the most common causes of food poisoning. Infectious organisms or their toxin can contaminate food at any point of processing or production. Contamination can also occur at home if food is incorrectly handled or cooked. Food poisoning symptoms, which can start within hours of eating contaminated food, often include nausea, vomiting, or diarrhea. Most often, food poisoning is mild and resolves without treatment, but some people need to go to the hospital. Well, earlier on this channel, I have already uploaded a short video about food poisoning. I hope you have seen that, and today I am going to present this illness in detail. Well, first of all, let me tell you the symptoms. Food poisoning symptoms vary with the source of contamination. Most types of food poisoning cause one or more of the signs and symptoms, which I am going to tell you now. Well, it may cause nausea, vomiting, watery or bloody diarrhea, abdominal pain and cramps, fever. Signs and symptoms may start within hours after eating the contaminated food, or they may begin days or even weeks later. Sickness caused by food poisoning generally lasts from a few hours to several days. If you experience any of the symptoms, if symptoms become severe, you should seek medical attention. For example, if there are frequent episodes of vomiting and inability to keep liquids down, bloody vomit or stools, diarrhea for more than 3 days, extreme pain or severe abdominal cramping, and oral temperature higher than 100.4 degree Fahrenheit, 38 degrees centigrade. Signs and symptoms of dehydration: excessive thirst, dry mouth, little or no urination, severe weakness, dizziness or lightheadedness. Neurological symptoms such as blurry vision, muscle weakness, and tingling in the arms. These dangerous symptoms which I have just told you, if they happen, then you should contact your doctor immediately. Now I'll tell you the causes. Contamination of food can happen at any point of production, growing, harvesting, processing, storing, shipping, or preparing. Cross-contamination, that is the transfer of a harmful organism from one surface to another, is often the cause. This is especially troublesome for raw, ready-to-eat foods such as salads or other produce. Because these foods are not cooked, harmful organisms are not destroyed before eating and can cause food poisoning. Many bacterial, viral, or parasitic agents cause food poisoning. Now I'll tell you about some causative agents for food poisoning. If I start discussing the symptom, sign, and the source of contamination of each organism, then the video will be longer, but I will tell you generally that the most common organisms which cause food poisoning are Campylobacter, Clostridium botulinum, Clostridium perfringens, E. coli, and Giardia lamblia, hepatitis A. Well, earlier on this channel, I have already uploaded a video about hepatitis A that can also be due to food poisoning. You can see that video, okay? And another infection that can be due to listeria, noroviruses, Norwalk-like viruses, rotavirus, salmonella, shigella, staphylococcus aureus, vibrio vulnificus. So these are the important organisms which can cause food poisonings. Now I'll tell you the risk factor. Whether you become ill after eating contaminated food depends on the organism, the amount of exposure, your age, and your health. High risk groups include older adults. As you get older, your immune system may not respond as quickly and as effectively to infectious organisms as when you were younger. Pregnant women. During pregnancy, changes in metabolism and circulation may increase the risk of food poisoning. Your reaction may be more severe during pregnancy. Rarely, your baby may get sick too. Infants and young children, their immune system have not fully developed. That's why this group is more risky, okay? People with chronic disease. Having a chronic condition such as diabetes, liver disease, or AIDS, or receiving chemotherapy or radiation therapy for cancer reduces your immune response. Now I'll tell you the complications. The most common serious complication of food poisoning is dehydration, that is a severe loss of water and essential salts and minerals. If you are a healthy adult and drink enough to replace fluids you lose from vomiting and diarrhea, dehydration should not be a problem. Infants, older adults, and people with suppressed immune system or chronic illnesses may become severely dehydrated when they lose more fluids than they can replace. In that case, they may need to be hospitalized and receive intravenous fluids. In extreme cases, dehydration can be fatal. Some types of food poisoning have potentially serious complications for certain people. These include listeria infection. Complication of a listeria food poisoning may be most severe for an unborn baby. Early in pregnancy, a listeria infection may lead to miscarriage. Later in pregnancy, a listeria infection may lead to stillbirth. Premature birth or a potentially fatal infection in the baby after birth, even if the mother was only mildly ill. Infants who survive a listeria infection may experience long-term neurological damage and delayed development. Escherichia coli, Escherichia coli, that is most commonly known as E. coli in abbreviated form. While certain E. coli strains can cause a serious complication called hemolytic uremic syndrome. This syndrome damages the lining of tiny blood vessels in the kidneys, sometimes leading to kidney failure. Older adults and children younger than 5 and people with weakened immune system have a high risk of developing this complication. If you are one of these risk categories, you should see your doctor at the first sign of profuse or bloody diarrhea. Now I'll tell you some preventive measures. To prevent food poisoning at home, wash your hands, utensils and food surfaces often. Wash your hands well with warm soapy water before and after handling or preparing food. Use hard soapy water to wash utensils, cutting boards and other surfaces you use. Keep raw food separate from ready to eat foods. When shopping, preparing food or storing food, keep raw meat, poultry, fish and shellfish away from other foods. This prevents cross contamination. Cook foods to a safe temperature. The best way to tell if foods are cooked to safe temperature is to use a food thermometer. You can kill harmful organisms in most foods by cooking them to the right temperature. For example, you can cook ground beef to 160 degrees Fahrenheit, and that is 71.1 degrees C. Steaks, roast and chops such as lamb and veal to at least 145 Fahrenheit degree. I mean 62.8 degrees centigrade. You can cook this lamb chops. Cook chicken and turkey to 165 degrees Fahrenheit. I mean 73.9 degrees centigrade. Make sure fish and shellfish are cooked thoroughly. Refrigerate or freeze perishable foods promptly. Within 2 hours of purchasing or preparing them, if the room temperature is above 90 degrees Fahrenheit, I mean 32.2 degrees centigrade, refrigerate perishable foods within 1 hour. Defrost food safely. Do not thaw food at room temperature. The safest way to thaw food is to defrost it in the refrigerator. If you microwave frozen food using the defrost or 50% power setting, be sure to cook it immediately. Throw it out when in doubt. If you are not sure if the food has been prepared, served or stored safely, discard it. Food left at room temperature too long may contain bacteria or toxins that cannot be destroyed by cooking. And do not taste food that you are unsure about. Just throw it out, even if it looks and smells fine. It may not be safe to eat. Food poisoning is especially serious and potentially life-threatening for younger children, pregnant women and their fetuses, older adults, and people with weakened immune system. These individuals should take extra precaution by avoiding the foods which I am going to tell you. Raw or rare meat and poultry, raw or undercooked fish or shellfish, including oysters, clams, mussels, and scallops. Raw or undercooked eggs are food that may contain them, such as cookie dough and homemade ice cream. Raw sprouts such as alfalfa, bean, clover, and radish sprouts. Unpasteurized juices and ciders, unpasteurized milk and milk products. Soft cheeses such as feta, brie, and camembert. Blue Band cheese and unpasteurized cheese. Refrigerated pets and meat spread, uncooked hot dogs, luncheon meats, and deli meats. I mean, the people with the weak immune system are those who are old and the pregnant women and the younger children. I mean, these are all of them are at high risk group. So these individuals should avoid these foods which I have just told you. Okay, now I will tell you about the diagnosis. Well, when the patient come to us, we take a detailed history, including how long you have been sick, your symptoms, and specific foods you have eaten. Your doctor will also perform a physical exam looking for signs of dehydration. Depending on your symptoms and health history, your doctor may conduct diagnostic tests such as blood test, stool culture, or examination for parasites to identify the cause and confirm the diagnosis. For a stool test, your doctor will send a sample of your stool to a lab where a technician will try to identify the infectious organism. If an organism is found, your doctor likely will notify your local health department to determine if the food poisoning is linked to an outbreak. In some cases, the cause of food poisoning cannot be identified. Now I'll tell you the treatment. Treatment for food poisoning typically depends on the source of the illness, if known, and the severity of your symptoms. For most people, the illness resolves without treatment within a few days, though some types of food poisoning may last longer. Treatment of food poisoning may include replacement of lost fluids. Fluids and electrolytes, minerals such as sodium, potassium, and calcium that maintain the balance of fluids in your body. Lost to persistent diarrhea need to be replaced. Some children and adults with persistent diarrhea or vomiting may need hospitalization, where they can receive salts and fluid through a intravenously to prevent or treat dehydration. Antibiotics. Your doctor may prescribe antibiotics if you have a certain kind of bacterial food poisoning and your symptoms are severe. Food poisoning caused by listeria needs to be treated with intravenous antibiotics during hospitalization. The sooner treatment begins, the better. During pregnancy, prompt antibiotic treatment may help keep the infection from affecting the baby. Antibiotics will not help food poisoning caused by viruses. Antibiotics may actually worsen symptoms in certain kinds of viral or bacterial food poisoning. You should talk to your doctor about your options. Adults with diarrhea that is not bloody and who have no fever may get relief from taking the medication loperamide that comes with the name of Imodium, or bismuth subsalicylate that comes with the name of Pepto-Bismol. You should ask your doctor about these options. Now I'll tell you some lifestyle and home remedies. Food poisoning often improves without treatment within 48 hours. To help keep yourself more comfortable and prevent dehydration while you recover, you should try the tips which I am going to tell you. Let your stomach settle. Stop eating and drinking for a few hours. Try sucking an ice chips or taking small sips of water. You might also try drinking clear soda, clear broth, or non-caffeinated sports drinks. You might also try oral rehydration solutions if you have severe dehydration symptoms of diarrhea. You are getting enough fluid when you are urinating normally and your urine is clear and not dark. Probiotics. Your doctor may recommend trying probiotics. Ask your doctor before trying probiotics. Ease back into eating. Gradually begin to eat bland, low-fat, easy-to-digest foods such as soda, cracker, toast, gelatin, bananas, and rice. Stop eating if your nausea returns. Avoid certain foods and substances until you are feeling better. These food and substances include dairy products, caffeine, alcohol, nicotine, and fatty or highly seasoned foods. Rest. The illness and dehydration can weaken and tire you, so you should take appropriate rest. Okay. Well, this was my video about food poisoning. I hope you like this video. If you have any question, you can post your question in the comment section.